Hello everybody, I am Dr. B C Kalmath, consultant cardiologist at Bombay Hospital, Jupiter and Horizon Group of Hospitals. Today I am going to talk to you about the importance of pulmonary hypertension. The pulmonary hypertension, the diagnosis, the management has been changing day after day because people did not know what is pulmonary hypertension earlier and the importance of treating it and most important of diagnosing it. Earlier, most of the patients who came with sudden syncope or breathlessness were either thought will have only heart disease or respiratory disease like COPD and asthma. No, lot of patients can have pulmonary hypertension due to a secondary cause. They were called secondary pulmonary hypertension like having heart disease, left to right shunts, congenital heart disease or a valvular heart disease or sometimes terminal ischemic heart disease also can have pulmonary hypertension. And these people have to be diagnosed properly because there is a great deal of treatment for secondary pulmonary hypertension because you can treat the valvular heart disease nowadays by surgical or non-surgical way. We have TAVR to severe aortic stenosis. You've got balloon mitral valvotomy, which can, the most important pulmonary hypertension in a young lady is a mitral stenosis, which is often missed. So, we have to keep your eyes and brain open to look at, to diagnose pulmonary hypertension because just a good echo can tell you that the patient has pulmonary hypertension and then you can check whether this is due to valvular heart disease or congenital heart disease or any other heart disease. When you rule out all of this, then there is a major entity called as primary pulmonary hypertension, which was unto date not diagnosed because there was no big treatment for this. But nowadays, with good diagnostic aids, echo, advanced CT, MRI, we can diagnose a lot of primary pulmonary hypertension patients who have got lot of treatment nowadays with the drugs, excellent drugs like the drugs which can work on the pulmonary circulation, the PGI2s and PGA2s. So many drugs are coming wherein we can treat them better. So I would implore upon you to not neglect the pulmonary hypertension diagnosis because the patients can be treated to a large extent in knowing exactly whether he has got secondary pulmonary hypertension or primary pulmonary hypertension, because I understand the prognosis of primary pulmonary hypertension was very grave earlier, but with the advent of new drugs like Bacetran and Bosentan and many other drugs which are acting on the pulmonary circulations, including the PGI2s, the prostaglandins, have made a sea-vast difference on these patients. Thank you.